In this video, we're going to take a look at some disorders caused by failure of the normal development of the neural tube and its associated tissues. These disorders are known by a number of different terms. A traditional term used is that of spina bifida, literally translating as bifid or double spine. This relates to the fact that when you examine some of these children, because they don't have spinous processes or any parts of the vertebrae in the midline, you would feel something either side of the midline, and it would feel as if the spine was in two halves. Another term, a broader term, refers to neural tube disorders, and this implies that these conditions all have abnormalities of the neural tube. Well, this is true to a greater or lesser extent. However, the milder forms do seem to have only very minimal involvement of the neural tube and may indeed have normal development of the spinal cord or brain. Probably a more precise and inclusive term is that of spinal or cranial, for that matter, dysrafism. Dysrafism essentially is a catch-all term referring to problems with the fusion of structures within the midline. And that could either be problems with the fusion of the neural folds to form the neural tube, or with the fusion of the dorsal elements of the vertebral column or skull to form the back of the spine or the back of the skull. So we've got a number of terms all relating to disorders of either the neural tube or the bony coverings of the neural tube. Let's start off by looking at it in a bit more detail by looking at an electron micrograph of an embryo. And here we can see this embryo is undergoing neurulation. And remember that the neural tube starts to form in the cervical region and then essentially zips up cranially and down caudally. So we have this cranial neuropore up here and this caudal neuropore down there. If the cranial neuropore fails to close, we can have neural tube disorders affecting the head. And if the caudal neuropore fails to close, we can have neural tube disorders affecting the spinal cord. The second bit of development to think about is the way in which the vertebrae form. Here we're looking at a cross-section through an embryo. We can see the neural tube here in light brown. And in this very pale pink colour here, and these brown dotted areas here, we can see the dermomyotome, which is that part of the somite that contributes to the dermis of the skin, and also the myotome, which ends up forming muscle. But the part of the somite we're interested in today is the sclerotome, this green area. And the sclerotome essentially has components that surround the neural tube and go on to form the bony vertebrae. And specifically in neural tube disorders, it is failure of development of this dorsal sclerotome which can lead to an open vertebral canal and the possibility of herniation of contents out of the vertebral canal itself. So the neural tube disorders fall along a spectrum of severity. The most severe neural tube disorders are incompatible with life, and the mildest neural tube disorders, some of us may be walking around with them and not realise that we have any defect at all. The most severe type involves the entirety of the neural tube. So part A here, we have what's called craniarachisis. Cranio referring to the head, rachis referring to the spine, schisis referring to the failure of this to close. Craniarachisis is incompatible with life. These fetuses are usually stillborn, and it occurs because the neural tube has failed to close along the entirety of its length. So it didn't even close at this point here at the cervical level. It didn't close anywhere along its length, meaning that this tissue that's exposed here is essentially what should have been the lumen of the neural tube. So these regions here are the neural folds which have failed to close. So this is incompatible with life, and and thankfully it's only seen quite rarely in the developed world. Next along the spectrum of severity we have anencephaly. An meaning without, encephaly brain. So in anencephaly the brain fails to develop, and this is due to failure of closure of the cranial neuropore. So in anencephaly the neural tube develops caudally but fails to develop cranially, and in that case the brain tissue does not form normally, and these children once again don't usually live for very long at all after birth, if indeed they are born alive in the first place. So anencephaly, very poor prognosis caused by failure of closure of the cranial neuropore. These are the neural tube disorders involving the cranial end. There are others, but I don't want you to worry too much about those. Now let's focus on neural tube disorders affecting the spine. The most severe type of neural tube disorder affecting the spine is known as a myelocele, or just rachis on its own. Okay, so myelocele is synonymous with rachis. And in myelocele, what happens here, once again, is that the neural folds fail to fuse together and that neural tube fails to invaginate, leaving this open, raw area in contact with the outside world, which should have become the central canal of the spinal cord. So in myelocele, otherwise known as rachis, we tend to see very severe neurological defects, often involving the lower limb. Next in severity is the so-called meningomyelocele. Okay, so meningo meaning involving the meninges, myelo meaning involving the spinal cord, and cele meaning that it's all enclosed within a meningeal cyst. In meningomyelocele we have a cystic lesion protruding out through this defect caused by failure of closure of the neural arch. And filling this cyst is CSF and the spinal cord. So in this case, unlike in myelocele or rachis, the neural tube has developed normally, but because the dorsal arches of the vertebrae have not formed, the spinal cord has herniated through along with the meninges. Meningomyelocele is associated with neurological deficit, but not as severe as myelocele. Next, and less severe than meningomyelocele, is meningocele. And in meningocele, what we have here is a spinal cord found within its normal location, but a cystic fluid, CSF-filled area which has protruded through the defect in the dorsal arch. Okay, so meninges, cele, fluid-filled cyst. This is a meningocele. And in meningocele, these children don't tend to do too badly from a neurological point of view. However, as you can imagine, with all of these, they are very susceptible to meningitis due to the fact that their meninges and spinal cord is not being protected by the bone. Now, it may be the case that a child is born where there is no visible cyst, and all that you might see is something like a tuft of hair or even a nevus sitting at the level of the lumbar spine. And what this can be is something called spina bifida occulta, where they have a normal spinal cord, they don't have any fluid-filled cyst, it's just that they happen to be missing some of the dorsal arches of some of the lumbar vertebrae. These children don't tend to experience any severe neurological deficits at all, and people will often go through life with this not knowing that they have it. And that's about the mildest form of neural tube disorder, and that's simply caused by the failure of closure of the dorsal arches of the vertebrae, caused by a problem with this dorsal sclerotome. Before I finish, it's well worth just saying a few things about how we can prevent neural tube disorders. And of course the best way to do that is with folate supplementation. Now, no one really knows how folate helps to prevent neural tube disorders, However, it is believed that it has an important role in assisting the fusion of epithelial cells together during development. Folate should be started before a woman intends to try to conceive. Something like 3 months before conception is ideal, and continued throughout the pregnancy. And it is folate supplementation which has led to greatly decreased rates of neural tube disorders in the Western world. So thank you very much for listening to this short talk on neural tube disorders.